Now, our next application is for treatment of plantar fasciitis. So plantar fasciitis is inflammation of the fascia that lines along the foot here, often caused by overuse injuries, caused by too much repeated jumping on a hard surface, somebody who changes training surfaces quite a lot, like tennis players. So we're trying to take the pressure off this plantar fascia. I'm using the 1 inch here, you can use 1.5 inch, depends on what you're comfortable, but it's the non-stretch, the zinc oxide tape. I'm going to apply an anchor here just around the transverse arch, so around the base of the toes here. Again, I'm not going the whole way around, different schools of thought on that. I don't like to completely encircle a limb. If I was worried, however, that was going to fray while the person was now out playing a match, you can cover in that gap with another piece of tape. That's no problem at all, to make sure that that doesn't come loose. The danger is putting one continuous piece of tape all the way around. So I have my anchors in position. Now I'm going to start from the 5th toe side, coming down along the side of the foot, round the heel, and then crossing back over to the 5th toe again. Turn off your tape. I'll cut that down in a second. Watch for crinkles. You may have to crease it slightly, which can be easier than actually putting a wrinkle underneath. I'm going to put a second one now from the 1st toe side. So down along the side of the foot first. Stick that in onto the foot. Around the heel, I'm going to crease that out to make a dimple at the back. And then up along, back up along to the big toe. Okay, smooth it out. So I've now got an X coming in across the plantar fascia. You can do those again, overlay each one again by about half. And cut your tape. So it is difficult to avoid, but trying, if there is going to be a crinkle, get it out of an area where there's going to be a lot of weight. And from the big toe down along that medial arch again, swing underneath, and back up. So we're creating an X here, crossing over where the plantar fascia is. If you like, you can get the client up now, get them to walk around, see if that feels comfortable, see if they want more support. If they do, apply another strip coming down each side. And once you're happy that you have enough support, you then apply little transverse strips, just going across each one, just to close the whole lot in. I'm going to switch and use the 1.5 inch just to cover a wider area. And it's usually important when you're applying these strips that you go from lateral to medial. Rather than pulling this arch down, I'm trying to help to support it and lift it up. As I said there, if the tape doesn't tear the first time, or if you get a wrinkle in it, if I try and tear that across there now, it's not going to tear easily. So get rid of that bit. Start with a fresh piece of tape. And that's about it. You can cover over. Again, same as before, you can use your cohesive or your elastic adhesive to cover over the whole area. I would trim those pieces down because they're going to get in the way, just to get them out of the way. And then literally a couple of nice loose circles around the foot, just to give a little bit of extra support. And then to finish off, same as before, use your zinc oxide tape, just a strip of that to keep that elastic adhesive bandage in place. So cover over the end of that here. Anywhere you're worried that it might loosen or fray while you're exercising, cover it over to keep it nice and secure. Any excess parts, remember, blunt-edged scissors, take your time, be careful. Again, get the client up, ask them to move around, check that it feels comfortable, check your capillary refill, and check that they have normal range of motion, which is what you're looking for. But that's your general support taping for plantar fasciitis, either for a sports person or for somebody who is just trying to recover from the injury and wants just to give the area a bit of a rest, because it can become very chronically inflamed So it's a handy one to have.